Welcome to the Mortuary Masterclass, brought to you by the Champion Company, where preservation meets purpose, and every step is part of your journey to safer solutions. In this episode, we're looking at a topic many embalmers have heard mentioned over the years, Creutzfeldt-Jakob disease, commonly called CJD. It's one of those cases that occasionally comes up in prep room conversations, but when we step back and look at science, the picture becomes much clearer. Creutzfeldt-Jakob disease belongs to a group of disorders known as transmissible spongiform encephalopathies, or TSEs. These are rare neurodegenerative diseases that affect the brain. Under microscopic examination, affected brain tissue develops tiny holes called vacuoles, giving the tissue a sponge-like appearance. That structural change is where the term spongiform comes from. According to surveillance data from the Centers for Disease Control and Prevention, CJD occurs worldwide at a rate of about 1 case per million people each year. In the United States, that translates to roughly 350 to 500 deaths annually. Most cases occur in adults between 60 and 70 years of age. About 10 to 15% of cases are inherited and linked to mutations in the PRNP gene. The majority are considered sporadic, meaning they occur without a known cause. What makes CJD unusual is the infectious agent involved. It isn't caused by bacteria, and it isn't caused by a virus. It's caused by a prion. A prion is a misfolded protein. Normally, nerve cells contain a protein called prion protein, or PRP. In prion disease, that protein changes shape. When that happens, it can trigger nearby proteins to misfold as well. As that process continues, abnormal proteins accumulate in brain tissue and damage nerve cells. Clinically, this leads to rapid neurological decline, including memory loss, coordination problems, muscle rigidity, and involuntary muscle movements. According to clinical data summarized by the National Institute of Neurological Disorders and Stroke, most patients die within a year of symptom onset, often within several months. At present, there is no curative treatment. For funeral professionals, the discussion usually centers around how prions behave in the preparation environment. One of the defining characteristics of prions is their resistance to many traditional disinfection methods. Research summarized by the CDC and the World Health Organization shows that prions can withstand procedures that normally destroy bacteria and viruses. Studies have demonstrated resistance to routine chemical disinfectants, alcohol-based disinfectants, ultraviolet radiation, standard formaldehyde fixation, and standard 121 degrees Celsius autoclave cycles. Because of this resistance, public health agencies recommend enhanced sterilization procedures when instruments may have been exposed to high-risk tissues. Documented effective procedures include high-temperature steam sterilization at 132 to 134 degrees Celsius for extended cycles, immersion in 1 normal sodium hydroxide, followed by autoclaving or extended exposure to high-concentration sodium hypochlorite solutions. These recommendations come from decades of laboratory research evaluating prion inactivation. Now let's place the occupational risk into perspective. CJD is not transmitted through casual contact. It is not airborne, and there is no evidence of transmission through intact skin. Historically documented transmission events have occurred almost entirely in medical settings involving contaminated neurosurgical instruments, dura grafts, corneal transplants, and cadaver-derived pituitary hormone treatments used decades ago. Current surveillance data does not show an increased incidence of CJD among funeral professionals compared with the general population. In other words, when universal precautions and professional protocols are followed, the system works. From a preparation standpoint, the tissues with the highest infectivity levels are the brain and spinal cord. Cerebrospinal fluid can also contain infectious prions, while most other tissues contain significantly lower concentrations. If a complete autopsy has already removed the brain and spinal cord, the potential exposure risk is reduced. Preparation protocols should follow standard universal precautions with full barrier protection, including gloves, protective clothing, eye protection, and respiratory protection when splashing may occur. Many embalmers choose to double glove during preparation procedures, and some use cut-resistant undergloves as an additional layer of protection. And like most professionals learn early in their careers, if a glove tears, you stop, change gloves, and continue. Reusable instruments that may have contacted high-risk tissues should be mechanically cleaned first, then decontaminated using procedures consistent with DDC, and WHO Prion sterilization guidance. Work surfaces should be thoroughly cleaned before applying disinfectants, and recommended contact times should always be respected. Arterial and cavity solutions used during embalming are designed to preserve tissue and reduce microbial activity. Here is where the sanitation qualities of glutaraldehyde-based fluids can really shine. Fluids like dye form 40, LEX, trisan and cavity 48 to name a few. However, current scientific literature does not consider embalming chemistry alone a validated method of prion inactivation, which is why enhanced infection control protocols remain important when prion disease is suspected. Creutzfeldt Jakob disease remains rare, but it represents one of the most scientifically unusual infectious diseases studied in modern medicine. For embalmers, the takeaway is straightforward. Accurate information, consistent precautions, and disciplined preparation procedures allow professionals to safely care for the deceased while continuing to serve families with confidence and professionalism. So every new piece of knowledge becomes another milestone achieved. Thanks for tuning in to this special edition of the Mortuary Masterclass, championing the prep room with purpose because embalmers matter, and every step forward is part of your journey to safer solutions. That's the champion difference.